From the time of conception onwards, the baby interacts with the emotional life of the mother, whose state of mind is affected by her relationship with her partner. In this intimate relationship with the mother, the body and psyche of the baby are transformed. Understanding derived from detailed observation of infants with their families forms the base of this book, designed to shed light on psychoanalytic work with children with eating difficulties and their families. There is a focus on the infantile experiences of the child in therapy and on how the infant in the child is accepted, understood, and transformed, both through the relationship between the child and his or her parents in family therapy and the child and his individual psychotherapist. Described are therapeutic interactions between the therapist and eating disordered children and young people, which have at their base the emotional resonance stirred up in the psychotherapist's countertransference experiences with the child. The therapist's use of the countertransference, the main therapeutic method, involves receiving the child's experiences, which may be present only in bodily states, actions, or pictorial images, and then enabling the child to find symbols and subsequently words suitable for meaningful and deep communication through words. Described is the therapist's capacity for mentalization, which is similar to the tone of the mother's primary tasks, which is to use reverie to experience and then think about and meet the baby's physical and emotional needs, which include the baby's feeling of coldness, warmth, hunger, the need to be safely held and protected, and the baby's need for intimacy with the parents. The collaborative attunement between mother and baby is the process through which the image of the body is constructed. The baby integrates perceptions and sensations of having physical and emotional needs met and forms an attachment to the caregiver. The chapter's many clinical vignettes portray how the therapist's understanding provides the eating disordered child with an opportunity to recover and develop infantile aspects of the psychological and physical self. Most importantly, there is an emphasis on how the process of communication within the family and professional network surrounding the child requiring therapy, and in particular the external and internal family's way of supporting, containing, and communicating emotional experiences, create the foundation of this work. Perhaps what differentiates this book from other books on eating disorders is the focus on the child's relationships with the family from early infancy onwards. In particular, Chapter 1, The Theater of the Mouth, describes how the parent's relationship with their eating disordered child enables the child to mourn losses, work through conflictual issues, or be a source of perpetual tension within the child, because his or her feelings cannot be sufficiently elaborated upon and given emotional significance.